Good afternoon, everybody. Jim Shulman, Executive Director of the Tennessee Commission on Aging and Disability. This is our regularly scheduled webinar. Today is May the 3rd. We welcome everybody on the call. As usual, we have a chat panel to the right. If you have any questions, you can certainly do it that way. Send us a question, and if we have time at the end, try to leave some time to answer any questions. And also the slides and the recording will be made available after this webinar, so you can get access to it on our website. So as typical, we usually give you a quarterly data update. Today's main topic is going to be about palliative care, which is a very interesting type of medical care that is getting a lot more attention than it used to. And so we'll explain kind of what's going on from the state standpoint about palliative care. We'll also give you some legislative updates. The legislature adjourned last night, and so they will be gone until next spring, but there was a lot of activity, particularly there was some activity around palliative care, but also around elder abuse and Alzheimer's. So we'll talk about that, and then we'll see if we have some time for questions at the end. So as typical, we start with quarterly data updates. These numbers are second quarter numbers from October to December of 2018. So the comparisons will be for the same period of time in 2017. All right, October to December of 2017, that's what we're comparing to. Home delivered meals, you can see the number of people that we serve, 5,922. Those are the number of home delivered meals, over 333,000. That was an 8% increase over fiscal year 18. Congregate meals stayed about the same. See the number of people that were served and also the number of meals. Remember, congregate meals are meals like at a senior center where people get together and have lunch together. Options are Homemade for Personal Care Service Program, funded and controlled by the state of Tennessee, by the General Assembly. Served almost 2,400 people during that period of time, second quarter. That was a 1% increase over the same period of time in fiscal year 18. Family caregiver had a big increase, 25% increase over the same quarter in fiscal year 18, 1,004 individuals served. And then the public guardianship program, again, a state-sponsored program. Funding comes from the state for this program. We get about $1.2 million. One of the things that you'll hear eventually is that in the governor's proposed budget, which has now been passed by the House and the Senate, we got an extra $1 million for this program. It's very important. Our programs are capping out because we've got so many people in the program. This will give us some room to expand. 416 individuals served during the second quarter of 2018, 1% increase over the fiscal year of the same time frame in fiscal year 18. Remember, October to December 2018 is fiscal year 19. All right. So, a discussion about palliative care. So, the Palliative Care Task Force was created initially in 2017 to take a look at a couple of different issues regarding the overall definition of palliative care and the barriers that were coming in place in the state to, first of all, learning more about it and utilizing palliative care. The 2017 palliative care met, I believe, 3 times during that period of time between September and December of 2017. One of the recommendations that they had out of that task force was to create a permanent advisory council through state legislation, and that's what happened. In 2018, Tennessee State Palliative Care and Quality of Life Council was enacted as Public Chapter 955. Purpose of the council, as you can see, twofold: continually assess the current status of palliative care in the state and review the barriers that exist to prevent such care from being obtained and utilized by the people who can benefit from it. And number 2, provide recommendations to the governor and to the General Assembly on issues related to its work. So again, 2018 Palliative Care Advisory Council created by the initial task force. The initial task force was chaired by Senator Joey Hensley, and the vice chair was Sabi Kumar, who's state representative north of Nashville. And Representative Kumar is also a member of our Tennessee Commission. He serves as a member of basically our board. So that task force got together, and again, one of the recommendations to the General Assembly was to create a more permanent advisory council, and that's what they did. So what is palliative care? So you see a fairly detailed definition in front of you. Palliative care is specialized care for people facing serious illness. And then there's a definition that's a little further down about how you define serious illness. Focusing on providing relief of suffering, physical, psychosocial, and spiritual to maximize quality of life for both the patient and the family. A lot of discussion on palliative care. There's always questions about the definition. This was put together by that advisory council to be very specific on what it is. The focus is on serious illness. A lot of people confuse palliative care with hospice care. Hospice care is basically focused on the last 6 months of life, providing care and basically comfort during that 6 months of life. Palliative care, so maybe the best way to define it is all hospice care is palliative care, but not all palliative care is hospice care. Palliative care is dealing with people who have a serious illness but may live a long, long life. They just happen to have a serious illness. And so if you look at that definition, again, the focus is on providing relief to suffering and improving somebody's quality of life. So what you're trying to deal with somebody who may have a serious condition, but they may live for 25 or 30 years, you're trying to figure out, based upon medical care, how to allow people to maximize their quality of life with that serious illness. That's what palliative care is all about. Again, palliative care is not hospice care. Hospice care is a type of palliative care, but not all palliative care is hospice care. Palliative care, you're looking at, in many cases, very long-term situations, again, involving people with serious illness. So palliative care focuses on a couple of different things. It's usually team-based. We've got a lot of people working together. You can see the list, doctors, nurses, social workers, and so forth. It can include both inpatient and outpatient care. Any age and any stage of serious illness. Remember, this is much longer term. It can be provided along with curative treatment. That is, you're trying to cure the illness at the same time that you're also providing palliative care, which allows people to kind of function, have a good quality of life with that illness. And again, it's different than hospice care. Quality of life. Primary benefit of palliative care is increased quality of life and decreased symptoms that are burdening for the patient and for his or her family. Again, you're trying to improve the patient's quality of life. Home-based palliative care, what they're trying to do is increase, if you've got a home-based situation, it's designed to increase the chance of dying at home and reduce symptom burden, in particular with patients with cancer. So we've had this discussion before. Most people would much rather, if they've got a serious illness, they really want to live at home. That's where they want to be. Home-based palliative care increases the chances of people continuing to live at home. When we talk about blended outpatient and home palliative care, that overall, what they're trying to do with that care treatment is improve concerns with anxiety or with appetite, depression, well-being, nausea, things like that. What they're trying to do is, again, remember, it's about increasing the quality of life of individuals, maximizing that quality of life. One of the other things that is interesting about palliative care is provides a possible tool that can be used to reduce overall spending on end-of-life care without a decrease in a patient's or caregiver satisfaction. Palliative care is not one of those things that people are, sitting there looking at it strictly for cost reduction, but what it's trying to do is just improve the overall situation. Now, so some indication nationally has indicated that non-cancer patients with at least 6 months of palliative care, That type of treatment has been shown to decrease the total hospital charges by nearly $275,000 for those individuals. Tremendous amount of money being saved based upon the fact that palliative care is being used. Home-based palliative care, cost per patient during the final 3 months of life was $12,000 lower than individuals with usual care. So usual care meaning typically if you're someplace else, you're not at home, you're at a facility, that type of thing. So again, remember, palliative care is not one of those things where people all of a sudden start mentioning it and it's all about cost reduction, but it's one of those things designed to improve overall quality of life, and in the end, it actually is a cost reduction for individuals that are using it. Advisory Council recommendations. So the Advisory Council has met twice so far. This is the new group that's been put together, chaired by Mohana Karlakar out of Vanderbilt University, who is one of our specialists in palliative care across the state. Recommendation 1, recognition of confusion surrounding the definition of palliative care and the fundamental differences, as we've talked about, between palliative care and hospice care. One of the recommendations is to adopt the council-approved definition of palliative care in order to provide clarity and education to healthcare practitioners and the public. As most of my staff knows, I always hate wordsmithing things, but this is important because people get very, very confused over what palliative care is. And most people think as soon as that word is brought up, that it means that people hear it and means they think they're dying. That's not the case. Again, hospice care deals with 6 months. We understand that part. Palliative care is a much longer spectrum of care. And so part of the idea behind all this is to try to make sure that people actually understand it and utilize it. So I know a lot of people would say, well, my doctor, is always concerned about my quality of life. Well, so in many ways they've been practicing palliative care. But this is becoming more and more of a specialty care type of practice in hospitals and so forth, just in terms of being focused on not only the individual, but the people that are surrounding that individual as they go through the serious illness. So again, you have the definition on the slide. Hope you will share that definition with other people. Recommendation number 2, ensure that comprehensive and accurate information on palliative care is available to the public, healthcare providers, and healthcare facilities through the development and maintenance of a statewide palliative care information education program. That's very, very important. Again, a lot of people don't necessarily understand what it is, and you can define it all you want, but you have to make sure that information is available out there so people actually have the benefit of utilizing it. So different strategies involved, develop a communication plan to outreach to providers, patients, families, and caregivers. That's something the Advisory Council is going to be working on. And another one is a statewide conference focused on palliative care, which is being set up. It's going to be held on September 27th. Big deal. Tennessee Hospital Association is involved with that. Again, this is one of those things that's very important for people to understand. I know sometimes people get scared when they're talking about these types of things, but it's really something that's very beneficial, improves overall quality of care, and the idea is you can utilize it. It's something that can be utilized. It's something that's actually very good for people. Again, conference coming up on September 27th. There'll be information at the end of the slide if you want to get information about the palliative care and for the palliative care conference. Just let us know. We're also working on creating a online directory of palliative care resources across the state. One of the barriers is people don't know where it is or how to go find it, so we're going to be working on that as well. Recommendation number 3, communicate directly with the different members of the palliative care system. Again, you can see who's in that system and the associations that represent these members to assess the strengths, weaknesses, and needs of the palliative care workforce in Tennessee. So a lot of this, as you can see, the recommendations from the Advisory Council are dealing with definitions and education, trying to get information out, communicating that information so people can take advantage of it. More information, if you're more interested in this stuff, you can actually go look at that website at the bottom. So you can go to our website and learn about palliative care. Again, you can see the website there. You can find out, again, the purpose of what all this is about. You can find members of the council, the advisory council, who serve on the Palliative Care Advisory Council. We have a quarterly meeting scheduled. There are reports that are coming out, will be coming out over the period of time, and there are also resources available about palliative care. I think it's important enough, obviously, we have picked up where the Tennessee Commission on Aging and Disability is kind of the administrative lead on this from the state of Tennessee. We work with some very, very astute and very smart people who are on this council who have been working on this. This is important, particularly for people who are suffering serious illness, but it's also important for their families. I think it's one of those things where you should take a look. Don't be scared to look at it and pass that information along. I know that I've talked to people who are going through serious problems and serious illnesses, and I mention it and they've never heard of it, or they just don't understand it. It could be really, really important to know what it is and utilize it. So anyway, if you have a minute, take some time, go to the website, learn more about this. And obviously, if you have questions, you can ask during this webinar, or you can provide questions at the end, or just let us know, what's on your mind about this type of medical care. Legislative updates. Again, the legislature adjourned last night. But let's first talk about the federal government. Lots of action going on at the federal level. These are two things that are most pertinent to our programs right now. Older Americans Act for reauthorization in 2019. Very, very important. I just came back from a conference in Atlanta with all the State Union on Aging directors from the Southeast states and from the Mid-Atlantic states, and this came up. Everybody's very, very interested in this. It's reauthorizing the Older Americans Act. It's coming up, obviously, this year. We have the great benefit of working with Senator Lamar Alexander's office in Washington, Senator Alexander being head of the Senate Health Committee. Extremely important. He was so vitally important when the thing was reauthorized several years ago, and he will be vitally important this year as well. So I think other states are jealous because they know that Senator Alexander is our senator. And so when we were down in Atlanta, they realized how important Tennessee is to the overall national picture on Older Americans Act. Anyway, we appreciate the help of the staff at Senator Alexander's office. This is going to be very important as we get through during the remaining months of 2019. Older Americans Month, the Presidential Declaration on April 30th, 2019. Anyway, that was always helpful to have people recognize that we have a lot of older Americans living in this country, and it's getting bigger and bigger all the time. So anyway, just letting you know about that. All right, so legislation, state. Again, General Assembly left last night. Here's what they did. Senate Bill 265, House Bill 257 by Robertson Littleton created a Class C felony offense for specific types of medical fraud. Specifically, what was happening is that people will call folks, particularly older adults, concerning their medical condition or health and start trying to obtain information from that older adult, and then will send unsolicited or specifically refused medical supplies to that older adult and then file a claim or submit a bill with the state's Medicare plan for reimbursement. I know that happened to Senator Roberts and somebody in his family. This is creating a Class D felony. So, again, calling somebody, getting in touch with an older Tennessean, finding out information enough where they can start sending equipment to that individual and start billing them for stuff they don't need, medical fraud. Class D felony, it's very, very good. Changed it from a civil to a criminal penalty. That's what this bill did. Senate Bill 199, House Bill 249 by Senator Briggs and Representative Carr recreates an elder abuse task force. So we had an elder abuse task force several years ago that made major strides. And some of the things that passed in the state, including the PLAWS law, which deals with financial institutions, a lot more increased penalties on elder abuse, some coordinated activity on states working together. This one is bringing back that elder abuse task force. A lot of the same members will be coming back, or same departments. There's more of a focus on financial exploitation on this one. So it will be convened fairly soon. I think typically it's the lead senator, the person with the most experience in the General Assembly, that convenes it. But that will start sometime over the summer. And again, based upon what happened last year, or not last year, a couple of years ago with the Elder Abuse Task Force, I would expect to have big things coming out of this thing. A lot of people working together to make some real serious improvements. I've told you this before, but Tennessee is nationally recognized as one of the leaders in terms of trying to prevent elder abuse in the country. Senate Bill 711, House Bill 686 by Stevens and Kumar, allows the district public guardian to serve persons with disabilities younger than 60 years of age. This was a bill that was pushed in many ways by this agency. We kept running into more and more situations where judges are finding people, particularly with disabilities, who are younger than 60, who are outliving their parents, and the courts are ending up with these individuals in front of them because they need someone to make decisions for them, healthcare decisions and financial decisions. It didn't happen quite, doesn't happen all the time, but we keep getting some of these. We've had like 5 or 6 that have come through, and what is going on are most of these people are, again, under the age of 60, and the court is trying to figure out who can step in and help. And so what happened in the past was that the courts would call us and say, is it okay if the public guardian steps up in this case? Public guardian was always willing to do it, but the state law said it had to be 60 plus. You had to be 60 years of age or older. We kept running into people who were 58 and 59, and the courts were asking very nicely if we could take them on. And we tried to oblige in many cases as we could. But we did not like the fact that the law said 60 and above, so we opened up an option which allows some control over the numbers, but allows the courts now to have a place where they can determine if they really do need the help. So this was an important piece of legislation, at least in our mind, that passed. Senate Bill 28, House Bill 37, Senator Crow and Representative Whitson creates the State Alzheimer's Disease and Related Dementia Advisory Council. Pretty big deal that this got created. It's going to be a fairly large group of people looking at Alzheimer's, looking at the plan, and coming up with recommendations for the governor and the General Assembly. That will start this summer as well. Other things that passed: Senate Bill 1039, House Bill 909, Garden Hiring Keithling, Elderly and Vulnerable Adult Protection Act of 2019. This was a bill that was pushed by the District Attorney General's office. They did a very good job over the last several years of increasing the penalty for people who are being exploited and being abused. And so this was, I think, probably the final piece of what was basically a 3-year effort to get those penalties up. This particularly looked at physical abuse. So congratulations to the DAs and congratulations to the General Assembly. Again, Tennessee being recognized nationally for its work, this was another major step in terms of protecting older Tennesseans. Senate Bill 810, House Bill 843, Reeves and Sexton. This deals with palliative care. This was fixing some issues last time. We added the definition. This was all about basically opioid use, and it was clarifying some things regarding palliative care. Sometimes palliative care requires some additional assistance in terms of dealing with opioids, and it was trying to make sure that it was very clear, not overstepping, but trying to make sure it was very clear kind of what palliative care is all about. So anyway, Section 7, Section 11 got added to deal with some issues regarding palliative care. I want to thank the Palliative Care Advisory Council. They were very, very helpful, along with people from the legislature, Tennessee Medical Association, the governor's office. A lot of people were involved in this in terms of making sure that this was done correctly. Senate Bill 1323 and House Bill 1323 Robertson Daniels, Palliative Care and Quality of Life Advisory Council. That's the advisory council that we had. There was apparently some confusion about the sunset date, so they got that fixed from an administrative standpoint. So that's it. We got 5 minutes left. I talked about a lot of the legislative stuff that happened over the last 4 months. We had some very good people up here, Ryan Ellis and Annalee Cothran, spending a lot of good quality time over with our members of our General Assembly. I believe they were probably tired. I used to do that on a regular basis, and I remember the day after a session, I used to like to walk down to the Legislative Plaza and walk around because it was very, very quiet. Everybody went home. Things will pick up, relatively soon, particularly with the advisory councils and the task forces, but a lot of energy and a lot of effort, I know, goes into work by the members of the House and the Senate, by the staff, by everybody involved with the actions of the General Assembly, and in the end, we appreciate all the work. And in terms of this year, there was a lot of pretty major things that happened regarding aging. Anyway, we'll see if there's any questions. Question about can we attend the Palliative Care Advisory Council meeting? Sure. They're open to anybody. And I would also say that, even if you can attend, if you can send information in, that's really, really helpful. We want examples of people who have utilized it. If there's concerns about it, if there's barriers, that's what we're looking for. So, again, we have a lot of very, very good people on this thing that actually are out there serving patients. And so they bring information in, but any other information that comes in, we certainly would appreciate it and look forward to your comments. We have another question that's come in. Was additional dollars included in the budget to fund the changes in the public guardian law, the age changes? So actually, since we've only had 5 or 6 cases of this, the fiscal note we determined to be minimal. There was nothing there because it's not a lot, and we always check first with the district public guardian to make sure that they're okay with handling the additional cases. But as I said at the beginning, we went to the administration, the Lee administration, and talked about the public guardian program, which had not received funding, increased funding since 1986, which was the year it was created. So the folks that did the public guardian program, our area agencies on aging and disability, have taken the existing funding that they've gotten all these years, matched it with some other things, raised some money through different sources to help keep the program functioning. We went to the administration, asked for $1 million recurring so we could beef up the program, take on more responsibilities, more people, and they put it in the administration amendment to the appropriations bill, and it is in there and it stays. So there is additional money included in the budget for the entire public guardian program, not necessarily just because of that law. We have another minute or two. Any other questions coming in? I think we've got one more. So suggestions on where to send people who call for respite care, for a home caregiver. So we have a program. Obviously, we have a respite care program. What I would do is call our agency and then or email us if you have to, and we'll get you to the right place. Different places you could call there's an area agency on aging and disability, kind of like a information and assistance line. We've given that to you before. You could call that, but you can just call us directly. And I think at the end of this, our phone number will be on there. So, yeah, if you're looking for help in any way, there it is, 741-2056, or you can email us at that email address. Always feel free to call us with any questions that you've got. Our job is to serve you all. And if you have questions or concerns, if you have comments, if you have examples of things that you want to share, please give us a call. And again, if you send it to us, we will make sure we send it out and get it to the right place. I believe that's it. thank you all for listening. Thanks for the good questions. We will be back in a couple of months with another webinar topic. Please let us know what you think, and we appreciate you being on the call. Have a good rest of the afternoon.